The increasing popularity of vaping and mounting concerns about health risks have prompted actions by state and local officials. On September 24th, Governor Baker declared a health emergency and banned the sale of all vaping products for 4 months. Even before that, city officials moved to place new restrictions on the sale of tobacco and nicotine products to minors. To explain the actions and the reasons for concern is the medical director for the Boston Public Health Commission, Dr. Jennifer Lowe. Thank you very much for being with us, Doctor.
Thank you.
First of all, talk about this growing the growing popularity of these products. What have we seen recently?
With vaping specifically, there is a youth epidemic now. I mean, vaping is very high in young teens and young adults, and it's specifically because the delivery method is different than your traditional tobacco cigarette products.
And for people who haven't tried this, what exactly are they inhaling when they're using these products?
It's an aerosolized. It's an aerosolized product, so you are actually inhaling the nicotine in this aerosolized vape, this smoke.
What about the health problems we've been hearing about, especially the severe problems?
Well, nicotine in general has long been associated with health problems. It contributes to increased rates of diabetes, cardiac disease, emphysema. So that is the same no matter what the method of nicotine delivery is. The chemicals in tobacco has also been known to increase the risk of cancer. A lot of the chemicals in the vaping paraphernalia, it's not known what those cause long term.
And what about some of the people who have had serious problems? I mean, what I've been reading, these are not just older people who've been doing it for decades. Some of them pretty young.
I think that's what's most fearful and what may have prompted all this concern is that these are young individuals, with many of them with no known history of lung problems, now having coughing, severe shortness of breath, fatigue, and sometimes death. So this is not what you would expect from any nicotine product at the age.
Of course, what is also going on here is that the city is concerned about some of the other nicotine and tobacco products and how they're being used more and more often by young people. Explain the rationale for the actions taken by the commission, even before the governor's action.
So before the governor's action, the Boston Mayor Walsh, he asked the Board of Health and Boston Public Health Commission to look at ways to change policy in order to address this epidemic around youth vaping, and also to address the increased menthol use in our Boston neighborhoods. So the regulation itself closes the loophole with regards to mint and menthol. In 2015, the regulations stated that you could sell flavored products excluding mint and menthol at 21 and older shops. Now we're closing that loophole and saying all flavored products can only be sold in 21 plus shops. So that restricts the access to youth. On the menthol side, research has shown that marketing practices have targeted menthol for communities of color. So you might find a packet of menthol cigarettes are actually cheaper in communities like Roxbury as opposed to, say, Beacon Hill. So by implementing these regulations, we are really addressing the health disparities that come from menthol cigarette smoking.
Now, of course, I think one of the things that seemed maybe attractive at first about smokeless products was that they're not as harmful as cigarettes and cigars. And what do we know about these products, even at least as a gateway to something worse?
I mean, I think, as a physician, I tell my patients that vaping and cigarettes and cigars, it's all nicotine, and the nicotine in them causes long-term effects. As I mentioned, diabetes, heart disease, cancer. The delivery of the product is different, and some would say that vaping may be smoother, maybe safer, but there's really no evidence to suggest that. And there's really no evidence to suggest that it actually works for tobacco cessation either. So.
And nicotine is addictive, too.
Absolutely, nicotine is addictive, and Boston Public Health Commission has a ton of programming, a tobacco control program that specifically addresses how difficult it is when you become addicted to nicotine and how you can stop smoking or vaping or using any of the products when you're ready to do so.
Some of these products have also been seen as attractive as a possible tool for giving up cigarettes. How do these changes affect people who are really earnestly trying to quit smoking?
You know, vaping has not been shown to help with tobacco cessation. So really there are a lot of methods available. I referenced bphc.org. There's the 1-800 Quit Now smoking cessation access line. Tobacco cessation products and counseling, virtually every insurance company pays for it. It's free for Mass Health. And through bphc.org, you can access free programming. So, you know, quitting smoking, quitting tobacco use is very, very difficult. And so we're trying as much as possible to provide resources to help people to do so.
I know the city and the state are both putting restrictions on products sold in retail settings. Any advice to people who might say, well, I'm not going to worry about that, I'm just going to order something online?
So you're right, the online products is more difficult to regulate. I mean, I think that the bottom line is that we are fearful of what these products can do for anyone's health. And so I think when thinking about that, if there is an opportunity to quit, if this presents an opportunity that you can quit, I think people should take it.
I do want to ask you about one other timely concern, the next flu season. What's the outlook out there?
So if you're going to get a flu shot, it's time to do it. We encourage everyone to get the flu shot starting now. It will last all season, and it can dramatically reduce your risk of getting the flu if you get it.
And I understand the expectation is for a pretty strong strain of flu going around this year. How does that match up against the vaccines?
So the vaccines are the strains. We have a quadrivalent vaccine, so there are 4 strains that should be covered with the flu vaccine. And the strains in the vaccine are determined by the World Health Organization. I mean, really, it is supposed to be a strong season, but the flu vaccine itself will reduce your risk of getting the flu regardless of what the strain is.
Now, I know that a lot of viewers out there might say, I'm fairly young still, I'm not going to be knocked out by the flu, but I guess they have family members. It could be kids or aging parents around, so I guess they have to think about that.
Yeah, absolutely. I think, you know, if you don't want to get the flu shot for yourself, then get it for your grandmother, your young niece, your cousin who has a medical condition. A lot of people can't get the flu vaccine because of medical concerns. It might impact their health. But if you as a healthy person get the flu vaccine, you are protecting them as well.
We should finally mention, if people want more details about any of these topics, you've got the website they can check out?
bphc.org. We have a website on flu, how to access flu vaccine as well, and we have a lot of information on tobacco control as well.